Hello, everyone. I'm Teresa Mangum. I'm the director of the Obermann Center for Advanced Studies at the University of Iowa. And this program is part of our Obermann Conversations series. The Obermann Center, you may know, is a research center on the campus that supports artists, scholars, and researchers in their work, as well as we also have programming for grad students, and we have a number of public programs. And I just wanted to mention two before we get started. First, though, I also want to thank the Iowa City Public Library and especially Bond Drager. Bond is a staff member at the library. And if you have technical difficulties or questions, you can go down and chat, find Bond Drager, and you can write directly to her for assistance. You can also put questions in the chat as we go. We'll talk for a while about several questions the group has agreed upon, but I'll be watching the chat and happy to share your questions. I also wanted to mention that you're being recorded. We are being recorded, and you won't show up, but if you write something in chat, your name will be there if that's a concern for you. Our next Obermann conversation will be on February 16th, and the topic is COVID's lessons, end of life, and grief. And I also wanted to tell you about a program that's on January 27th that we're doing with a group at Chapel Hill, UNC Chapel Hill and University of Colorado that we're calling Cultural Postmortem 2020. And this is a program in which artists and scholars are talking about what can they do, what can they contribute to discussions of where our nation is and could go forward from where we are here. So let me introduce our really wonderful panelist, and then we'll jump right in. And I'm going to be brief. They have so many accomplishments, and I apologize to them that I want to have time for conversation. So Patrick Brady is getting his PhD in community and behavioral health in the College of Public Health at the University of Iowa. And he is working with the Iowa Department of Public Health and the Iowa Food Bank Association to consider how COVID-19 has impacted older Iowans' ability to get enough food, among other topics. Katharine Broton is an assistant professor in educational policy and leadership at the college, in the College of Education. And her work looks at the role of poverty and inequality in higher education. She's the author of a new book, Food Insecurity on Campus, Action and Intervention. Joan VandenBerg is the Youth and Family Development Coordinator for the Iowa City Community School District. And Sarah Witry is a visiting assistant professor. She's in the UI School of Social Work and was recently the director of services at Community, where she oversaw the crisis intervention and food bank programs and also led COVID-19 programs. So let's jump right in, you all. And we wanted to start off first by, by asking a question, what we mean by hunger and how we make assessments of hunger. And I thought that we might ask Sarah to get us started on that topic, if you wouldn't mind, Sarah, and then the rest of you feel free to jump in.
Yeah, so thank you first to Obermann Center for organizing this, to Teresa, and to the Public Library for hosting, and Bond for your work today. This is an important topic, and it bears repeating as much as possible in the community. When we talk about hunger, we often use the words hunger and food insecurity interchangeably. And so I think what we want to make sure that you know is that this conversation is really about that food insecurity, which is when people don't know when their next meal is going to be coming from. They aren't able to afford the basic food that they need for their family. A lot of times what we see, how people experience this is skipping meals, or eating less than they really need or want at a meal, or making significantly less nutritious decisions when they're eating. And the causes of food insecurity are bigger than just the individual. The straightforward issue is that people don't have food they don't have money to pay for the food that they need for themselves or their family. But the systemic issues that go into that include the lack of a living wage, the lack of paid leave for many people. They go back to healthcare. For a lot of people, they don't have affordable healthcare. And that can mean that they maybe have a condition that needs to be treated partly with better nutrition, but they can't afford that. It can mean that they have higher bills that they are then having to put their money toward instead of food. And we do know that when people are having to choose between multiple bills, between housing, between utilities, transportation, getting to their employment, between healthcare, they often are choosing those things first instead of food. And then, other issues when we talk about housing, particularly in our community, we have an issue of a lack of affordable housing. And by affordable, we just mean that people can afford it in their budgets. When we look, we see that disproportionately people are spending more than half of their income on housing, which means this is a technical term, that they're extremely housing cost burdened. And if that is your situation, you're likely to end up making food insecure choices and having to, because you just don't have enough money to go around. One of the other systemic issues that we wanted to bring attention to is disproportionality. And I pulled up a little bit of information. So food insecurity, this is from Feeding America. Food insecurity has always been disproportionately high in communities with large Black populations. Before the pandemic, Black individuals were 2.4 times as likely to live in food insecure households as white individuals. And that is nearly 20%. So 1 in 5 Black households, food insecure. And so when we talk about the pandemic, what we see is people who are struggling in general are struggling more and are struggling the most. There hasn't been a lot of equalizing that has happened in this pandemic, and those disproportionalities and those inequalities are only getting greater. So I think I will bring it back to Teresa now with that overview.
And I so appreciated in the conversation I had with you all earlier, the way that you helped us right from the first moments of the conversation think about the way hunger fits into a larger social justice and equity framework. So I appreciate you reminding us of all of these intertwined challenges that hunger is one symptom of, one part of that net. And that's a topic I know we're going to all want to come back to through our conversation. One of the things that you all were telling me that I didn't realize is how hard it is to assess the level of hunger in a community. And I know that's part of the research you all do, Katie and Patrick. Why, and others of you too, why is that so difficult to really get a handle on? Do you want to start, Katie?
Yeah, I can take a stab. In some ways it's a moving target, right? And as Sarah did a great job explaining, food insecurity exists on a spectrum, right? There's those with high food security, no problems. Those who are marginal, they might be worried about bare cupboards at the end of the month. Those with low food security who are changing the quality of their diet, maybe subbing in that low nutrient food, maybe even relying on liquids like soda to try and feel food and suppress those feelings of hunger. And then those who are actually cutting back the quantity of their food, they're cutting and skipping meals. And my work is in the higher education sector. And what we see in that sector mirrors a lot of what we see in larger society. Here at the University of Iowa, there's a survey and it asks students, are you cutting or skipping meals because you don't have enough money or resources for food? And the most recent data I've seen is from 2018, and 16% of our undergraduates, 1 in 6 respondents, reported that they're often skipping or cutting meals because they don't have enough financial resources. You can imagine, like Sarah said, if somebody's paying maybe half of their income towards housing, and when you add in food and transportation, utilities, other supplies, that doesn't leave a lot of room in your budget for college tuition. Fully 60% of students in that survey, 6 in 10, said that this has happened to them, even rarely, right? That they're cutting, skipping meals. So the students banded together to start a pantry on campus. Particularly, again, we have those disproportionalities. I'll say our students of color, our immigrant students, those who identify as having a disability, right, are all overrepresented in this population. So they came together, opened a pantry, and in fact, the numbers that I shared with you have slightly improved compared to before the pantry opened on campus. And I'll share that last fiscal year, the campus pantry served almost 600 individuals and distributed almost 60,000 pounds of food. So I want to shout out to the campus pantry team, and particularly Sarah Henry, who helps us understand those numbers and has them publicly available on their website if you want to learn more. And we might get a bit more into COVID when we come into this, but basically they're on track to double those numbers this year, as we have seen the pain from COVID and earlier the derecho really impact our communities who are already vulnerable.
Thank you. And Patrick or Joan, did you want to add anything about these challenges of assessing who's hungry and what the numbers actually are?
Yeah, so anytime you're trying to measure something as complicated and that has, as we've discussed, all these different inputs that are resulting in that social situation where there's not enough resources to food, who you ask really matters, how you ask it, what you ask, those all matter. And when we collect data around food insecurity, we're making assumptions about certain things. So we're asking the right people in our research method for applying weights and looking at things to try to get a representative picture. But those are assumptions. So in my view, maybe it's better to look at things over time and longitudinally so we can see if things are getting better or worse. And what we've seen as a result of coronavirus is that clearly things are getting much worse. So Feeding America, which is a very large anti-hunger organization, conducts a lot of studies and monitors this stuff over time. So one of their more recent studies looking nationwide showed that about 17 million people, more people are food insecure in 2020 compared to 2018. So that's a huge jump. Another survey that was conducted specifically looking at the impact of coronavirus surveyed 1,500 people. And when we're thinking about this problem, again, it's important to think about those different systems. So one thing they did was looked at people whose employment had been impacted and broke down the results in that way. And they found that 40% of households had some disruption in their job. Among individuals who didn't experience any disruptions, 20% were food insecure. So that's a relatively high rate compared to before the pandemic, where it was about 10%. But among households where somebody did experience an economic disruption, the rate of food insecurity was 55%. So there's really that huge disparity between those two groups. So we have a lot of evidence showing that this problem has emerged. It was here before, but it's really been accelerated and is emerging due to the pandemic.
And I'm going to come back to you, Patrick, to have you tell the audience a bit about what SNAP is, one of these critical programs. But before I do that, Joan and Sarah, it was so impressive to hear that in the midst of this huge challenge that Johnson County is very fortunate to have some strong resources in our pantry system. And I wonder if you all would just talk for a minute about what you see, what those resources are. And Sarah, you could start with the pantries, and Joan talk about schools.
Yeah, so our county and I think that this really fits with a trend that where there have been supports in place, where people have been doing well in their personal lives, they're faring better than people who were not doing as well before. So again, where things were going good before, they're not as good, but they continue to remain ahead of other people who maybe were struggling more. And our county had a strong network going into this pandemic. So we have multiple pantries across the county. We have Table to Table, which is a food rescue organization, this is something unique. This does not exist in every community. So Table to Table is actually going and gleaning food that grocery stores had that is still good, but was going to be thrown away because it wasn't as sellable. And many other places across the community, and feeding into that network. All of these food providers were also talking with each other and already had relationships with each other going into the pandemic. And then we had additional food programs. Joan will talk about the schools. They've been doing really great work, and some other collaborators along with the schools and the pantries. There's also senior feeding programs. We have a wealth of things going on. And there's also a great perspective in our community that is really just about really valuing and honoring the people who need the food and giving them the best choices, trying to give them the best access, really saying, how can we make this as easy and high quality as possible? And so when the pandemic began, we were in a better position countywide to respond. And as a result, community pantry, community food bank, Coralville Community Pantry, North Liberty Community Pantry, they all came together to deliver food. So they have a delivery line. That was a new program. A lot of the other programs in the community pivoted in the way that they provided service so that they would also provide different services. Our local Feeding America subsidiary, the Haycat Food Reservoir, which is up in Hiawatha, they serve a 7-county region, but they have increased doing kind of food drops, these big kind of food drop events across their regions to make sure that more food is available. So there's really just been a lot of stepping up. And really our nonprofits work extremely hard in this community. It's really an honor to be among our nonprofits here, and they've all really stepped up to put in extra work in a time that it has been challenging, because there are a lot of amazing people in our community who volunteer and give their time, and many of them haven't felt comfortable doing that. Some have continued, and I'll actually give a shout out because I noticed that there are some community food bank volunteers who are in the audience tonight. But many people just found that they couldn't do that safely, and that has put an extra strain on many of our nonprofits. But through all of that, they have really stepped up. Community Food Bank actually opened a different site for their food pantry so that they would actually have space that now that it's cold, people can come inside and shop. So it just so many examples of amazing work of so many nonprofits across our community.
And we'll talk at the end of the program about ways we can all be supporting those nonprofits and send you to a space where you can find a number of them listed. But Joan, of course, people are hearing a lot, especially about kids, and when kids aren't able to go to school, so that even those who use the free lunch program aren't in school. And you were telling us wonderful stories about how your agency is dealing with that issue.
And I want to echo what Sarah had to say about our community really views this as a human right that we're feeding our children. And I feel very fortunate that our district also takes this very seriously, because even prior to the pandemic, kids get 2 of their meals a day at school, but during summer and break and that sort of things, that's a huge resource that the families don't have to feed their children. And so when the pandemic started, we did a grab and go lunch program. And so at the secondary schools and at Hills Elementary, no questions asked, parents can come up and get a free lunch for their kids. And we have served since March 478 lunch meals. So that's an enormous number of meals that we've done. And I just have to give a big shout out to our nutrition services program, because they worked like our human service agencies. They had to pivot very quickly to do things much differently than what they usually have done in the past. And they rose to that challenge. And then also I want to give a shout out to our building administrators, because similar to what Sarah was saying about volunteers, we were very concerned about the exposure that families would, or volunteers would gain by the COVID. So our building administrators this summer volunteered on a regular basis to deliver lunches in the neighborhoods. So I can't stress enough of how fortunate I feel to be in a community that takes hunger seriously. And we know when you talk about the need, we can only know what the need is based on what we see among the children. And if they're hungry, they're not learning, and often we see behaviors. And so we've seen an increase in the need, but I'm happy to say that I feel like we've been able to respond to that need. What I think sometimes we worry about is those kids that we don't know about, because if they hook into our system, I think that we have good resources to offer to the kids and families.
And you remind me that we also talked about the fact that while on one hand, we're all grateful that we have such good systems here in Johnson County, that at the same time, we're aware that a lot of extra resources have been brought to bear because of COVID that will not survive after COVID.
Mm-hmm.
And I wonder, maybe other people like me, Patrick, didn't know a great deal about SNAP and how crucial it is now during COVID, but in general for funding, taking care of children's hunger. And I wonder if you could just explain kind of SNAP 101, what that that fund does.
So yeah, SNAP is the largest anti-poverty and anti-food insecurity program in the United States. It stands for the Supplemental Nutrition Assistance Program. You may be more familiar by its colloquial name, food stamps, but it doesn't really exist as actual food stamps anymore. So what it is participants get a electronics benefits transfer card, so an EBT card. It's just like a debit card that they can use on qualifying food purchases. And the amount that of funding they get depends on their income and some other factors. So if you have a lot of savings, you may not be eligible for SNAP because you're expected to use those savings to pay for food before you become eligible for that program. The amount that participants get can be as little as $17, which really won't go that far. But it can go up to $200 or more, depending on the size of the household. So it can contribute significantly to a household's food budget, but it's not really meant to be paying for all the food that they're acquiring. There's also, some gaps. There's not necessarily high utilization of this program among individuals who are eligible. Those utilization rates are lower for groups who may already be at a disadvantage that we talked about before, that may be more likely to be food insecure. And, if you're not aware of some of the resources, and I'm just going to plug one, which is the SNAP Iowa Food Assistance Hotline, which if food insecure or any eligible individual calls in, they can complete all the paperwork and all that stuff over the phone. But if individuals don't know about that resource, they would have to go through all the processes and all the paperwork of getting enrolled and making sure they're eligible and doing all that. So there's a lot of barriers to accessing this program, which is one reason people might not utilize it. There's also just a lot of stigma around SNAP and food stamps in this country, and that goes a long way back. And we really need to do more work to get rid of and address that stigma of using this program. There also can be misconceptions about things like, I don't want to use this program because me using it will take away benefits from someone who's more needy, which in my work with older adults, we hear a lot. And it's just not true. The program, everybody who's eligible is entitled to those funds to participate and receive those benefits. So us as, researchers and people out in the community need to do a better job making sure people understand that, if I use this program, I'm not taking away benefits from somebody else. It's the government ensuring that I have access to the food that I deserve and that we all pay for as a society through our taxes. So that's really the basics. It's, low income individuals who are eligible can apply. They get a certain amount of funds each month that they can spend on food.
Did any of you want to add to that? Joan, did you want to?
One thing I would add is that it was really great that the families got a supplement. If the kids were eligible for free and reduced lunch, they got a supplement of $300, and that was a huge benefit. And what I love about that is it's just, you don't have to, no application process, it just happened. And I think that's the kind of systemic solution that we're looking for to support families. And then also families could go buy the food that they want and that they eat, and that, we have a lot of different cultures represented in our district, so they could buy the food that is, of their culture. So I think that has been a great thing. And I think the other systemic thing that has happened is that the USDA has waived lunch fees. So right now, any child in the school district can get lunch without paying for it. And so there's greater access. And again, there's a stigma sometimes. And I think some parents are concerned about, the stigma of lunch. And also there are some of our undocumented families that don't want to take free lunch because they're concerned that will have immigration implications. So I think, I'm a huge advocate of those systemic solutions because we have lots of really great volunteer and charitable efforts out there. But this needs to be systemic. This needs to be something that lasts after COVID is gone, that, everybody benefits from.
And I know from our conversation that we would all agree that if we paid a living wage for employment, that many of these problems would be resolved overnight too, of course. Katie, you were about to jump in.
Yeah, I just wanted to put out there that there is a myth out there that college students are not eligible to participate in SNAP, and that's not true. It is a little bit more complicated. They have to meet an exception, but there are, we estimate about 3.5 million college students who are eligible to participate in the SNAP program. So I think taking advantage of the hotline, talking to people who know, that is a resource for some college students as well.
And Patrick, you've already alluded to this, but tonight when I was at the end of the, I guess it was NBC National News, they were talking about in New York City alone, the numbers of older people who are confronting hunger now under COVID, who had been part of services and communities before where this was not an issue, and how challenging it is to let them know what the resources are. It sounds like you're saying also challenging to get some people to take the resources that are available out of that kind of generosity. But I wonder, what are the communities you worry about who fall through the cracks, who are not getting this information, who are invisible to agencies that could help if they were in communication?
Well, I really think it's all those communities that our society tends to ignore in normal times. I don't think there's much difference now compared to before in who our society is putting a lot of value on and who it's really making sure to provide for. So my work with older adults, that's a population that is often kind of cast aside and said, you're not working anymore, you're not producing anymore, so what value do you provide for society? And that's a horrible view and extremely short-sighted. But, that's one of those populations that can fall through the gap. And they also, we live in a very individualistic society. We're taught from a young age that we're supposed to be providing for ourselves. We provide for our family, we're the breadwinner, we're responsible for our own situation. And that just ignores a lot of those larger factors that you can't control. So, medical costs as you age, they really go up. And you're on a fixed income and your rent's going up too. So you're really setting them up to have that limited food budget. And if they haven't been connected to those resources before, they haven't been introduced and told, really given the idea that you have a right to these foods, you should be eating healthily, you deserve this. They might not be using those resources. And we just need to do a better job in both using those resources okay, and just thinking about all those different communities and how we can support them overall, not just by, providing SNAP funding and connecting them to a food pantry, but how we can really support them to thrive.
Yeah, and if I could just add to that. So, I previously was with Community Food Bank, and so I am familiar with some of their statistics. And what I learned over time was that, food insecurity and using a food pantry in particular is a very transitory state for most people. What we really saw by and large, 1 in 5 household visitors every year, it was generally the story of I'm in between jobs. I don't have quite enough money to make it until my first paycheck with my new job, and I need help with food. It basically 1 visit, maybe 2 visits, and that's it. And that family may never need it again. It does say something that we have families that something like a job loss and a transition to a new job over a rather brief period could be enough of a disruption that they can't pay for food in that meantime. That in itself says something about the issue of minimum wage and living wage. But what we saw on the other end, 5%, just 5% of the households that were served would visit almost every week. And it's a very small amount, so it's pretty easy to actually look through. And these are people who visit a lot, so you get to know them. And the trend that I saw predominantly with people who had to visit that often was that they were on a fixed income. And what we see is that that low wage that wasn't enough at the time just kind of snowballs to the end of life. So they weren't making enough to meet ends meet to begin with, let alone save, let alone add to their retirement. So then they retire and they are, forced to just be living off of Social Security. But the Social Security payment is based on your highest wages when you were working. And so we end up seeing that people who were struggling while they were working, when they're no longer able to work, they have high medical bills and high medical needs. They often need extra supports, and they have the least in terms of resources to work with. And so I wanted to add that that kind of context to exactly what Patrick's saying. And also what Joan mentioned, when we talk about immigrants, there's been a lot of rhetoric and action in our country, particularly in the last few years, but longer than that, that leads to fear. Sometimes fear that is maybe not really manifested in real danger, but often in real danger that makes people reluctant to apply for benefits, makes them ineligible for benefits, that could give them more income, could give them more resources to then be able to have food. And I think our immigration policies, again, are something that is a larger system, but it contributes to just this even local problem of food insecurity in Johnson County.
And one of the things that we've talked about is that we tend to, that of course we want to address hunger in the moment and immediately. We don't want anyone in our community, in the world, to be hungry. But I'm also so struck by the challenge of meeting that immediate need while working on these larger systemic issues. And I just wonder what kinds of projects or policies do you see as possibilities going forward? We're about to turn over a new administration, federally, all sorts of, it seems like a moment for when change might be possible. What should we be asking for in terms of policy?
So I think one good example is that they're raising SNAP benefits by 15% in response to the pandemic. So the way they calculate benefits is based on a USDA thrifty food plan. So that's how they determine kind of what the benefit amount is. And they're just raising that amount. And that's very simple. It gets more resources to the people who need them. And it can be done, not easily, but relatively speaking, easily. So that sort of response. Iowa increased SNAP benefits to the maximum allowable amount for a household size. So those individuals, say, who are getting $17 a month because they were living alone, one person household, and because of their income, they got that little amount, were receiving about 200 after that. So that's a really immediate way. Just get resources into people's hands. There's still things that need to be done in terms of making sure they have access to healthy foods. Even that increase may not have been enough. And, it's likely to go away after the pandemic, and these issues around food insecurity are not going to go away. So we really need to think about making some of these changes more permanent.
Teresa, I love this question because, as I shared with the panel earlier, it's basically the thesis of our new book that I edited with Claire Katie. So I'm doing my plug, my food insecurity on campus. The university library has it as an ebook for anybody affiliated, and I know the public libraries getting it or already has it. So it's basically the argument we make. We have to be doing multiple things at once. We need to be serving the people who are hungry today. At the same time, we need to be pushing for these structural and cultural changes, right? We need to, by having this conversation, thinking about changing the culture of how we think about poverty and food insecurity in our communities. I also think we need to push on our social and education policies, at the same time make sure that we are utilizing what is available. This is something Patrick mentioned. There is so much stigma and bureaucracy and burden to access our social policy programs in the US that people who are eligible and could use them are not getting connected. And it's by design. It's called an administrative burden. There's a whole literature around it that this is how our system, we've chosen to make our system work. So among college students, only about 40% of those who are likely eligible for SNAP, are actually getting the SNAP benefits that they need. At the same time, there are students who are not making ends meet who are not eligible for SNAP. So we need to push for change there. We have this tradition in the US that some of our social policies use college student as shorthand for affluent and well-resourced. And that's just not true. It's not the reality. It hasn't been the reality for decades, close to 40 years. You know, the majority of our college student population is what we often call non-traditional or post-traditional, as we're trying to change the language around that, as they are the majority. So the last thing that I'll say on this point, because I know my panelists have good things to say, it brings it back to the beginning as well, what Sarah said. The policies that we have that will help people have affordable housing, living wage jobs, access to healthcare, access to affordable education so they can get a credential, whether that's a certificate, 2-year, 4-year degree, so they can help become economically stable. All of those things will go far to help ensure that we have a county that's not experiencing hunger and food insecurity. So it's really intertwined with all these things, attacking food insecurity, but also the root of the problem, which is, you know, poverty and how we have chosen to spend our resources as a society.
And I'd like to piggyback on that as well. I've been in the district a very long time. I'm old, and so when I started in the district in 1995, our free reduced lunch rate was 14%, and now it is approaching 40%. It's right around 39%. So that's a huge growth in the number of poor children that we have in our community. And this is not unique to Iowa City. This is a national problem, and we just have a growing number of people in poverty. And I think, you know, Sarah and Katharine and Patrick have all articulated this so much more eloquently than I can. It's just bad public policy. You know, we're losing our middle class. And so as a consequence, we have children and family in poverty who are struggling to eat, struggling to keep their housing, struggling for healthcare. So it's a huge systemic issue. And I think Sarah had mentioned there's kind of a tension between how you work on the big picture and systemic change, but also feed the hungry kid who's in front of you. And in terms of the free and reduced lunch program, it's a wonderful program. It serves a ton of kids. It's very bureaucratic. And so I have to give another shout out to our student and family advocates who help families get through that, you know, online application and understand what that means. And particularly for those who aren't as engaged, know what's going on or from a different country. It's a tall order. It's a tall order to get all of, you know, to help them through that process. So.
Yeah, I think that you actually said it very well, Joan. It's just bad policy. And when you look at the way that these policies are made, a lot of times there are a lot of details that go into them that as they roll all the way down to what does this look like for the person at the end, it looks like a lot of hurdles and a lot of barriers for not enough assistance. And that not enough is often not enough dollars. So SNAP benefits that are not really big enough because all the way, you know, back at the roots, we have some fundamental misassumptions about how much people need in order to live and how much food actually costs and how much time people really have to go and buy the least expensive option and cook it at home every single night of their life. And when we look at, so we look at SNAP and we see all the barriers to that. You look at free and reduced lunch. You know, if you miss that, you could end up with a lunch bill that they have to make you pay before you can actually get the free meals. That you obviously can't afford to pay that bill. So there are just some bureaucratic things that happen in all of these policies that end up putting barriers. And often the people who are most vulnerable to food insecurity and to poverty, to homelessness, are the ones that are caught up in those bureaucratic hurdles. So certainly more compassionate programs that are, you know, less bureaucratic. And when we say bureaucratic, really it's, there's a lot of process, and often it's to make sure that there aren't anybody possibly to receive these benefits that don't really need them. And in the meantime, a bunch of people who really need it can't get it as a result. So if we could give up this fear of the people who don't really need it to really focus on making sure the people who need it do, I think that would really flip on its head how we conceptualize the process for getting these things, which is so important. And you see that across a lot of systems, even when we talk about unemployment, Social Security benefits, a lot of these things, it is really, really hard to get them. So that's at the assistance level. There's a lot of policies that people can advocate for. You can advocate by speaking up. You can advocate by telling your legislators that it's a priority. And you can advocate with your vote. And those are all things that you can do while you're also supporting local day-to-day efforts to feed people today and tomorrow. You can be doing that advocacy and that voting and that civic engagement for a better day, in 6 months and a year and 2 years.
I want to welcome the people. If you do have questions for the panelists, feel free to drop them in chat and I'll track them. We've also been putting in chat some resources for people who'd like to learn more.
It's actually going to be the Q&A box, Teresa.
Oh, the Q&A box.
They want to look for the Q&A.
Oh yeah, it's over on the right-hand side. Thank you, Q&A box. Oh, and that means I should be watching that Q&A box. So another question that we were just talking about, the policies that we could all be working on, but I know a lot of the people who are here tonight are here because they're asking, what can I do to help? And what's your advice for people who want to be helpful in all sorts of corners in our community and on campus here?
Well, I think one thing I think is just look around their neighborhood and their community and people that they interact with and make sure that they're getting to the resources and know that. And I know the food service has the grab and go lunches right now at the secondary schools and also at Hills Elementary. And there's concern about people who are in a little bit more of the isolated areas of being able to get to those lunches. And what we've had is some fabulous volunteers who will go pick up 20 lunches at City High and then drive them out to Forest View Mobile Home Park so the families can get there. And so you can pick up lunches for other areas in your neighborhood and your community. And I think we've had a lot of really wonderful support to do that. But I think having eyes and ears in the community of who else might be needing that would be a very helpful thing. And also just the volunteering at the food pantries, I think is always, I think I have so many, personal friends who said, oh my gosh, it changed my life. It was such an amazing experience for me. I understand this issue so much better. So I think there's, it's a service to the community, but also a really great learning experience.
Other suggestions?
I will hop in, and I think I read the question in the Q&A, which was regarding what should the role of non-governmental organizations be in addressing hunger and food insecurity. And that goes back, there's the food pantries, there's right now, I believe that Heritage AEA and Heritage Agency on Aging and Horizons are engaged in senior feeding, and I believe that they can use volunteers. I mentioned earlier that a lot of volunteer-run organizations, and that's going to be those non-governmental nonprofits, particularly in our community, are looking for volunteers, people who are maybe at lower risk, who are, feeling more comfortable with, putting on a mask, checking their temperature, checking their risk, and then going out and providing services in a relatively safe way, of course, with COVID. I think in terms of the larger, the question that was there with the role of non-governmental entities is really to catch things that fall through the cracks. I think the problem is that the expectation of those agencies has grown from helping people when they, you know, kind of stumble, when they have an emergency, and they, what I like to think of is that there should be, if people have a strong personal support network, so what Joan was saying, go and check on your neighbors. And, you know, maybe your neighbor needs help. You know, that's your community, right? That's your local people. Maybe in whatever your community might be, you might be part of an organization, you might be part of a faith community. How is your community doing? Go and help them out. And if we all had those strong supports, then there wouldn't be as much need for social services. And social services, the non-governmental entities really should be filling those gaps. And what's really happened in our society, and because of government policies, are that those non-governmental entities are actually providing a huge amount of assistance and support to our communities instead of better policies. We are actually kind of taking the place of the work that the government should be doing to lift up the community.
Any other suggestions you all have for helping in, you know, here and now?
So I think it's a great idea to go out and volunteer again if you can do it safely and you feel comfortable doing that. But also just financially supporting those organizations that are providing food. They know how to stretch a dollar. So donating food is great, but if you donate whatever you would have spent on that food pantry or that food bank is going to be able to get what they need at a really good price and make it really help a lot more people. So if you have the means, I highly encourage just supporting those organizations financially.
Well,
Okay.
my list had a lot of things that, you know, my panelists have already shared. I think the first thing to do is to continue to spread awareness. You all are here. You are there, already know as much or more than those of us on this panel, or you're learning things. So, you know, share with your family and friends, share with your, you know, next door neighborhood app. Make sure that we're a well-informed community about the challenges and the resources that we have. You know, some of you might want to write in to your newspaper letters and things. The other thing I would encourage people to do is to keep learning. I've learned from sitting on this panel and hearing from my colleagues here, the great resources they have. There's lots of resources in our community. Volunteering, put yourself out there. There's a lot to learn. It's a pretty complex and diverse landscape when you think about food insecurity, especially if we expand it out to poverty more broadly. I will say that this is unlikely, but if anybody's interested in doing research in this area, I'm always interested in collaborations. I have a research team. We go by FIRED lately, Food Insecurity Research Engagement and Dissemination. We're trying to come up with clever names. So if you're working in this area, you can always connect with me after the panel. Obviously, donations, cash donations in particular, as Patrick explained, are always helpful. And as was already mentioned, being civically engaged, right? When we have elections, voting for people that will support the policies that you think are important, that will help alleviate food insecurity in our community. But even when we're not in an election time, letting your officials and our public officials know what's important to you. If you think food insecurity and hunger is an important topic that we need to be addressing at our local level, state and national level, let your voice be heard. Let your elected officials know what's important to you and what's important to our community.
Thank you. We only have a few minutes left. I just wonder if you all have any final words of advice or issues about hunger that you want to make sure we don't let people get away without bringing up. Are there any last minute comments or thoughts?
So I think one of the reasons we had this panel is because of all the stories in the news, all the talk around this issue. And that is because it is being exposed and accelerating due to the pandemic. But this issue isn't going to go away after we have a vaccine and life goes back to normal. And I'd encourage people to not let it fade back in people's minds, and to continue to make sure we're making progress on this issue in whatever ways we can.
Thank you. One of the things, oh, sorry, go ahead, Joan.
No,
Or was that Sarah?
I just want to echo that, Patrick said that very well. And that there are partnerships that I think that we have created during the COVID-19 crisis that hopefully can carry on after. And I think the collaboration and as much as possible, bringing food to the people. We have a lot like delivery services. We have food deserts in our county where people have a hard time even just getting to a grocery store. So, just keeping that awareness up and, reaching those more isolated folks, I think is something that it will be our challenge to continue on that kind of collaborative effort.
Yeah, what I was just going to say, one of the things when we had a meeting before this panel, and Joan really brought up the word hope, and there are a lot of things that have come out of the pandemic response that as really challenging and in many ways terrible and heart-wrenching this last year has been. We've also seen kind of those lights in the dark, and one of the things that I've seen is like just on Facebook, for instance, on a lot of the social networks and everything, as we've all had to move more online, or those people who have access have moved online. You see communities springing up to help each other. And like for one thing I know is like the Buy Nothing groups on Facebook have expanded. And I've seen evidence on there that people are really trying to be mindful of the people who really need things and putting that out there. I've seen people post on the Buy Nothing groups about resources that have come out, and hey, look, there's a big food event, or hey, look, there's this resource available. And it really goes back to neighbors just trying to help each other out and make sure they are aware and make sure people have what they need. Another thing that I've seen again on Facebook is people just putting a shout out and saying, hey, if any of my friends, if you need a meal, if you are needing help, if you need groceries, private message me, I will deliver. I want to help out. I'm doing okay. I want to make sure everyone else is too. And just those moments where people are really stepping up. I also know that our community has been really supportive of our nonprofits when they can. And I think a lot of people, when they felt like they couldn't volunteer, they have wanted to turn and volunteer with their dollars instead. All of that, it can get exhausting to stay hopeful and stay engaged and, keep giving what you can. But that's really what it takes, is if all of us can keep kind of giving that best of ourselves, and I think that we can move forward and really have better change and sustained change.
That sounds like a very good place to end on that hopeful note. I hope that you all carry away with you tonight the message that I've been hearing, which is hunger is a serious concern about which we need to have personal compassion and personal impact in serving our communities, but it's also part of a much larger net of equity issues around affordable housing, affordable health care, and a living wage that we have also, I hope we have a commitment to addressing on behalf of our neighbors, on behalf of our country and our world. So thank you all so much for making time for this panel. Thank you to the Iowa City Public Library. Thanks to Jennifer New, who organizes this series, and many thanks to the many, many people out there who joined us tonight. And I'm grateful for your compassion in wanting to learn about this issue. Take care, everyone, and we'll see you next month at the next Obermann conversation. Thank you so much. Bye.